Nurse Rebecca Thornton worked room 714 for 18 consecutive nights before anyone told her that the room had been sealed off since 1987, that no patient had occupied that bed in over 30 years, and that the hospital had no record of the woman she had been feeding, bathing, and medicating through nearly 3 weeks of 12-hour shifts. The confession she gave to hospital administration before her disappearance remains locked in a file that no current employee has clearance to access, but copies have surfaced in places they should never be, carrying a story that has caused 7 psychiatric admissions among those who read it completely. Rebecca had transferred to St. Ambrose Memorial Hospital in the fall of 2019, leaving behind a successful career at a Boston trauma center for reasons she never fully explained to her new colleagues. She was quiet but competent, the kind of nurse who arrived early and left late, who never complained about difficult patients or demanding physicians. Her performance reviews were spotless. Her patient outcomes were exceptional. She was, by every measurable standard, exactly the kind of healthcare professional that understaffed hospitals desperately needed. The 7th floor of St. Ambrose was reserved for long-term care patients, those whose conditions required extended hospitalization, but whose prognosis offered little hope of recovery. It was a quiet floor, often understaffed, where the most experienced nurses preferred not to work because of the emotional toll of watching patients decline over months and years. Rebecca volunteered for the assignment without hesitation, telling her supervisor that she found peace in caring for those who had been forgotten by everyone else. Her first night on the 7th floor proceeded without incident until approximately 3:15 in the morning, when Rebecca noticed a light blinking on the nurse's station call board that corresponded to room 714. She checked the patient roster and found no listing for that room, assuming it was an electrical glitch in an old building that had seen better days. But the light continued blinking with increasing urgency, and Rebecca's training would not allow her to ignore a potential patient in distress, regardless of what paperwork suggested. The door to room 714 was closed but not locked, opening smoothly when Rebecca turned the handle, despite what maintenance records would later reveal was a deadbolt that had been welded shut in 1987. Inside, illuminated by the soft glow of medical equipment that should not have been connected to any power source, lay an elderly woman in a hospital bed, her eyes fixed on the ceiling with an expression of absolute terror. Her chart hung from the foot of the bed, filled with handwriting that Rebecca did not recognize, documenting a patient named Eleanor Vance, who had been admitted for observation following an incident that was described only as the occurrence. Rebecca approached the bed with the calm professionalism that had defined her career, introducing herself and asking how she could help. The woman did not respond verbally, but her eyes shifted to meet Rebecca's with an intensity that made the experienced nurse take an involuntary step backward. There was something wrong with those eyes, something that Rebecca's confession would later describe as depth where there should have been surface, as if looking into them meant looking down an endless well that had no bottom and no light. The patient's vitals, when Rebecca checked them, were impossible. Her heart rate registered at exactly 47 beats per minute and never varied by a single beat. Her blood pressure read 120/80 with mechanical precision. Her temperature was 98.6 degrees exactly. Every measurement was textbook perfect, too perfect, as if someone had programmed a simulation of human vital signs, without understanding that real bodies fluctuate constantly. Rebecca noted these readings in the chart and convinced herself that the equipment was malfunctioning, that she would report it in the morning and request replacements. She returned to room 714 every hour for the remainder of her shift, compelled by a sense of duty she could not override despite the growing wrongness she felt each time she crossed the threshold. The patient never spoke, never moved, never changed position in the bed, but she was always watching, her eyes tracking Rebecca's movements with an attention that felt less like observation and more like hunger. When morning came and the day shift arrived, Rebecca mentioned the patient in 714 to her replacement, who looked at her with confusion and concern before explaining that 714 had been permanently closed for decades. Rebecca visited the room before leaving the hospital that morning, needing to confirm for herself that she had not hallucinated 18 hours of patient care. The door was sealed with caution tape and industrial locks, covered in dust that showed no signs of recent disturbance. She pressed her hand against the wood and felt cold radiating from within, a cold so intense it burned her palm and left marks that would not fade for weeks. She told herself she was exhausted, that night shifts played tricks on the mind, that she would feel better after sleep. But sleep would not come, and when she returned for her next shift, the light for room 714 was already blinking on the call board. This time she checked the door before entering the floor, confirming with her own eyes that it remained sealed and inaccessible. Yet when she walked down the hallway at 3:15 in the morning, the door stood open, the room glowed with that soft, impossible light, and Eleanor Vance lay in her bed, watching the ceiling with those terrible, depthless eyes. The chart had been updated in handwriting that matched Rebecca's own, documenting care she had no memory of providing. The pattern continued for 18 nights, each one adding new layers of wrongness that Rebecca documented in her confession with clinical precision. Eleanor began speaking on the 5th night, her voice emerging from her motionless lips like sound played backward, words that Rebecca's ears heard as English, but her brain struggled to process into meaning. The patient spoke about waiting, about the things she had done to be confined here, about the door she had opened that could never be fully closed. She spoke about Rebecca specifically, about why she had been chosen, about what was going to happen when the treatment was complete. Rebecca tried to involve other staff members, but her attempts met with inexplicable resistance. Nurses she asked to accompany her to the 7th floor would suddenly remember urgent tasks elsewhere. Physicians she consulted about the patient's strange vitals would become distracted mid-conversation and wander away without explanation. Security guards she approached about the mysteriously unsealed room would check their monitors and insist that the 7th floor showed nothing unusual. It was as if the hospital itself was conspiring to keep Rebecca alone with her impossible patient. The medical equipment in room 714 evolved over the 18 nights in ways that Rebecca could not explain. Machines appeared that she did not recognize, devices with no labels or manufacturer markings, instruments that seemed designed for purposes beyond her medical training. One machine displayed what looked like brainwave patterns, but the patterns formed shapes that Rebecca's confession described as geometric impossibilities, angles that should not exist in three-dimensional space, forms that made her eyes water and her head pound whenever she tried to focus on them. Eleanor's physical condition changed too, though not in any direction that medicine would recognize as improvement or decline. Her skin became increasingly translucent, revealing not the expected network of veins and organs beneath, but something else, something that moved independently of her body's stillness, shapes pressing against the inside of her flesh like hands pushing against a membrane. Her eyes sank deeper into her skull while simultaneously growing larger, the irises expanding until they consumed the whites entirely, leaving only pools of darkness that reflected nothing, not even the light from the machines surrounding her bed. On the 12th night, Eleanor finally explained what she was and what she needed from Rebecca. Her voice had changed by then, dropping registers until it resonated in frequencies that Rebecca felt in her chest rather than heard with her ears. Eleanor said she was a door that had been opened in 1987 by a patient whose name had been erased from all records, a door between what we understand as reality and what exists in the spaces between moments. She said she was not the patient, but the room itself, the space made conscious through decades of isolation and hunger. She said Rebecca had been selected because of something in her past, something in Boston that she thought she had escaped. The confession reveals that Rebecca had been involved in a patient death at her previous hospital, an error in medication dosage that had ended a life and been covered up through falsified records and transferred blame. She had fled to St. Ambrose, believing that distance would equal safety, that guilt could be outrun if only she moved fast enough. But Eleanor knew everything, speaking details that no one else could possibly know, describing the exact moment when Rebecca had realized her mistake and chosen to hide it rather than confess. The door had opened for her because she was already open, already hollow with secrets that something hungry could smell from miles away. The treatment Eleanor required was not medical, but something far older and far more terrible. Each night when Rebecca entered room 714, she left behind a piece of herself that she did not notice missing until later. Her reflection began to lag behind her movements by fractions of a second. Her shadow started falling in the wrong direction, toward light sources rather than away from them. Her co-workers commented that she seemed somehow less present than before, as if they were speaking to a projection rather than a person. She was being emptied, her confession explained, drained like a battery to power something that had been waiting 3 decades to finally complete its transition. The 16th night brought the first physical manifestation outside room 714, when Rebecca woke in her apartment to find the shape of Eleanor standing at the foot of her bed. Not the frail elderly woman from the hospital bed, but something else wearing that form like a costume that no longer fit properly. It was too tall, stretched in proportions that hurt to observe, its joints bending in directions that human anatomy did not permit. It stood perfectly still for 6 hours, watching Rebecca with those depthless eyes, until dawn light began creeping through the windows, and the figure dissolved like smoke in a sudden wind. Rebecca stopped going home after that, sleeping in the hospital break room where the presence of others seemed to offer some protection. But the protection was an illusion, as she discovered on the 17th night when she woke to find every other nurse on the floor standing motionless around her cot, their eyes open and empty, their mouths moving in unison to speak words in Eleanor's impossible voice. They told her that the treatment was nearly complete, that she had almost given enough, that one more night would finalize the transfer and allow what waited in room 714 to finally walk free. The 18th night began differently than the others. Rebecca arrived at the hospital, armed with information she had gathered during her waking hours. Research into the history of St. Ambrose that revealed a pattern of disappearances stretching back to the building's construction in 1952. Every 17 years, a staff member vanished without explanation, their records gradually erased from hospital files until no evidence of their employment remained. The pattern had been broken in 1987, when someone had managed to seal room 714, but sealing the door had not destroyed what waited behind it. It had only made it hungry. Rebecca's confession describes entering room 714 for the final time with the intention of ending whatever Eleanor truly was, of breaking the cycle that had claimed so many before her. She carried supplies she had gathered throughout the hospital, items that her research suggested might have power against things that existed between moments. But Eleanor was waiting for her with something like a smile on that translucent face, and the door closed behind Rebecca with a sound that echoed longer than any physical door could produce. What happened inside room 714 during the next 7 hours has been pieced together from security footage that should not exist, recordings from cameras that the hospital had never installed in that permanently sealed space. The footage shows Rebecca performing medical procedures that no training could have taught her, treatments involving instruments that appeared from nowhere and vanished when no longer needed. It shows Eleanor rising from her bed for the first time in 30 years, her body unfolding from the mattress in segments that revealed she had never been a single organism, but many things wearing the shape of one. The footage shows Rebecca's final act, the moment when she realized that she could not destroy the door, but could change what it opened onto. Using knowledge that the confession never explains how she acquired, she performed a procedure on herself that the hospital's best physicians cannot identify, removing something from her own chest that glowed with a light that cameras could not properly capture. She placed this object, this piece of whatever she truly was, into Eleanor's waiting hands, and spoke words that the audio equipment recorded as pure static lasting exactly 17 seconds. Room 714 was found empty the following morning, the door sealed exactly as it had been for 30 years, with no sign that anyone had entered or exited. Rebecca Thornton's employee file developed errors over the following weeks, her photograph corrupting, her records becoming illegible, her existence gradually being erased from every system the hospital maintained. Her confession was discovered in the administrator's desk drawer, written in handwriting that matched no known employee, sealed in an envelope that was dated 1987, despite containing references to events that had not yet occurred when that date would have been current. The current staff of St. Ambrose Memorial Hospital do not discuss room 714, though new employees sometimes ask about the door on the 7th floor that seems older than the building around it. They are told that it leads to a storage area, that it has always been sealed, that there is nothing inside worth investigating. They are not told about the light that maintenance workers sometimes see glowing beneath the door after midnight. They are not told about the call button that occasionally blinks on the nurse's station board, summoning someone to provide care for a patient who does not exist. They are not told about Rebecca Thornton, whose face can still be seen in photographs from 2019, if you know where to look, standing in the background of images she should not appear in, her expression peaceful, her eyes showing the same impossible depth that once belonged to Eleanor Vance. The confession ends with a warning that reads more like a prophecy than a caution. It states that the door has not been closed, but redirected, that what waited in room 714 is no longer waiting but walking, wearing a form it borrowed from a nurse who volunteered for a floor that no one else would work. It states that the cycle has not been broken, but transformed, that the hunger which once required 17 years between feedings has been satisfied in ways that no longer require patience. It states that anyone reading this confession has already begun their treatment, that the door opens differently now, that room 714 exists wherever guilt creates hollow spaces in the human heart. It concludes with 4 words that those who have read the confession report, dreaming about for years afterward, 4 words written in handwriting that seems to move when observed in peripheral vision.